Hey everybody, this is my concept map for Module 5, and in this assignment we were essentially asked to pick out 7 diseases and then find a way that they all connect towards the main prompt, which would be types of disorders of ventilation and diffusion. So our book gave us a pretty decent sized list of everything, of separate diseases that are influential in the ventilation and diffusion. So the first one I touched on was pneumonia, and this refers to the inflammation of the lungs occurring in the bronchioles and lung tissue, and the main treatment for this includes a course of blank. This would be a course of antibiotics. I also touched on chronic bronchitis, which is defined by the presence of a cough and has productive mucus production, which essentially just means that there is continual and often increased production of mucus and overactive production. It's a better way of saying it. And really the only way you can treat that is through bronchodilator therapy, steroids, and mucolytic agents. I also touched on ARDS, ARDS, and this is more of a acute, severe form of inflammation in pulmonary edema, but it doesn't really show evidence of fluid overload or impaired cardiac function on like diagnostic tests. But it's important that you, in this case, would get like that continual oxygen treatment. So like high flow oxygen through a mask or through a nasal cannula to keep your SATs in that healthy range, which as an EMT I always heard was like 92%, but here in the book it says 90%. Then I also touched on emphysema, which is the irreversible enlargement of air spaces beyond the terminal bronchioles, most notably in the alveoli. That results in the destruction of alveolar walls, and asthma, which is a chronic inflammatory disorder of the airways that results in intermittent or persistent air obstruction due to inflammation or bronchorestriction. And cystic fibrosis, which is essentially the same thing, just deals more with epithelial cells. We see that a lot of the concept maps here, or a lot of the points in it, kind of carry the same treatment. And that's what, responding to the prompt when asked what was the more difficult part, was trying to differentiate between all of them, because a lot of them are treated the same way. I'm guessing it's because there's more of a limited form of treatment. When you get to the lungs, when it comes to like steroids or anti-inflammatories, it's a pretty narrow path that you can take. So that was more the difficult part, was differentiating between them. And from a physical standpoint, trying to draw the lines, because I can't figure out how to get curved, fancy lines. But yeah, overall, it wasn't too difficult. Just a lot of them have the same kind of forms of therapy, and it can get a little bit repetitive. But I referenced the book here up top, so thank you.